My name is Christopher Jacklin. I'm one of the co-founders and CEO of Lucero. And what we do is build miniature organ models for drug testing. So in the early stages of drug discovery, specifically the hit to lead phase, scientists are still working with dozens and dozens of new potential drugs, and they're trying to figure out how they can improve them, and they want to see which of those drugs they can advance further on to the clinic. And in this phase, they depend on these iterative testing cycles called DMTA cycles to generate enormous amounts of data to enable that go or no-go decision. Those testing cycles take around 6 weeks. They run them one after the other over a 1 to 2 year time frame. They spend millions, and as most of us in the room know, because we're life science people, 90% of those drugs that do make it to the clinic still fail. And so the question for this phase of discovery is, why are they making so inaccurate decisions? And one of the reasons is because there's so many drugs still being tested this early on, and they need to generate so much data, they've been forced to use very simple and very cheap two-dimensional cell models for their cell assays. So you can imagine that basically it's a flat layer of cells, they put a drug on it, and they see how the cells react. But obviously, if you look around the room, nobody here is in 2 dimensions. So the data you get from that is very slow, and it doesn't really enable accurate decision making. So there's a better tool available. It's called spheroids. You can imagine these to be essentially miniature 3D organs. They behave much more similar to an actual human organ, so they reflect that human biology better, so they can enable quicker and more accurate decision making. The problem is that the logistics around using spheroids is a nightmare, so they've been largely inaccessible for industrial drug development, especially in the early stages when the throughput demand is so high. And so that's where we come in, where we can have the biggest impact. What we do essentially is eliminate all the logistical problems about using these advanced models. We've developed the first thaw and dose testing plate that contains advanced 3D spheroid models, and it's the only product that enables high throughput screening using spheroids made of human cells in 24 hours. So our plates here come preloaded with 384 individual spheroids. In our case, we're working with the liver right now, so you can think of them as mini livers. We grow them, we quality control them, package them, and cryopreserve them, and we ship those to the customers so they can focus on what they do best, which is developing new drugs. Just to illustrate how this can change the current workflow, so if users want to work with these spheroids today, this is sort of the process that they need to go through. It takes 1 to 2 weeks to culture them and all the risks involved in that culturing process, like contamination. It's very manually intensive, so it leads to an excess loss of very precious human cells. And they don't really have a good way to control how their spheroids grow. So in the end, you often end up with spheroids that are different sizes, different shapes. Some are more healthy, some are more dead. And you can't really use that to generate comparable data to make a go or no-go decision. And so when you bring in our plates, we turn that mess into a simple 2-step process where users take our plate out of the freezer, they thaw it, and they can start testing in 3D in 24 hours. So they don't need to do any culturing. It can be fully automated. There's rigorous quality control to make sure every spheroid is the right size, shape, and that they're all healthy, and will give data that can actually enable accurate decision making. And you don't need any new equipment or personnel or retraining to work with them. And so by using our plates early on in that hit to leads phase with those iterative cycles that I mentioned, we can reduce the time of those by about 20%, save the operational cost that comes along with that. And because we're shaving off a few months of development time there, those drugs that do make it to the market can come a few months sooner, which doesn't sound like a lot maybe, but on drug development, that is billions of dollars per month in potential revenue for blockbuster drugs. So how do we do it? Our secret sauce is in our manufacturing platform, actually. We've spent the last 5 years developing. It's where our IP is, and it's what allows us to scale up and standardize the production of these spheroids. So we can turn that fragile, manually intensive, painful process essentially into a plug-and-play consumable for our users. We're not the only ones making these organ models. There's definitely a handful of companies that are making very complex, very beautiful models. But what they've done is created models that work much better later on in the development timeline when you need higher complexity, when you're working with far fewer drug candidates, and where the throughput demand is simply just much lower. And so we see a big gap earlier on, like I said, in this hit to lead phase to have our plates come in and be that workhorse product there. If it was the car world, you could think of us a little bit like Toyota. It's definitely not the flashiest or sexiest car on the market, but it's absolutely one of the most widely adopted cars on the planet because it's reliable, it's affordable to run, and it's something that people depend on for their daily driving. So that's what Lucero is doing. Like I said, it's a workhorse product that scientists can trust day in and day out for that routine work. A few achievements I wanted to highlight. We've been developing the product alongside 4 large pharma companies since 2021. We're running a pilot right now with another SME here at the BioVenture Hub. We've raised about $2 million in non-dilutive funding so far, and we have filed for our patent family to protect our proprietary manufacturing platform. And we've just generated some very positive first data on the function of our liver models. Looking forward, 2025 is dedicated to completing our scientific validation and raising our seed round. 26, we're looking to launch our product onto the European market. 27 is when we look to scale up our presence and sales in the EU. And then 28 and 29, we're looking to expand the product portfolio as well as look into getting into the US market, aiming for break even in 2030. Business model looks like this. It's 2 parts, but the core revenue, of course, will be the repeat sales of our assay-ready plates. But there's also a lot of opportunity for us to layer on a specialized CRO service for specialty projects or maybe to do early access partnerships and increase the lifetime value of our customers. Healthy margins on the plates, and also a ton of opportunity to upsell them by adding different reagents and assay kits. The global 3D cell culture market is massive and it's growing extremely rapidly. One of the big drivers for that is this demand for new, more predictive in vitro tools like what we're building. We plan to establish a beachhead with our liver plates here in Europe for one specific assay for metabolic stability, but there's a ton of opportunity for us to expand the market share by looking at different customer segments like biotech SMEs and CROs. We can move into different geographies like the US I mentioned and potentially Japan. And we can also expand our product offering to offer different organ types like the kidney, heart, and lung. And this is the team that's going to do it. We're a group of young entrepreneurs with a lot of experience now in the world of 3D culture and drug development, also supported by a very strong board, scientific advisors, and we're plugged into a global network of large pharma companies who share our vision. So again, we're raising a seed round right now, 1.5 million euros, and that's going towards launching our product, our liver plate, onto the EU market next year. We're looking to scale up our internal production as well to fulfill on that, and also expand our team to support our growth. And we're looking for a couple investors who are very passionate and love cutting-edge new science, who are excited about what we're doing and share our vision. So if that sounds like you, then please reach out afterwards. I'm happy to take a few questions.
Thank you very much. And please raise your hand if you have any questions. Okay, we can start off with the raising of capital. What's the pre-money valuation of the company when you're...
I've left it out intentionally, not because there isn't a number, but I would share that with people who would like to follow up afterwards, if that's all right.
Okay. Yeah. And your technology, how is the patent around?
It's for the method and the system. Okay. So I think it actually might get split into 2 separate ones, but as of right now, it's one filing. We've just extended it through PCT in May this year, so that's where it's at.
Okay. Mm-hmm. All right. And how are you sort of reaching the users? Do you need to work with key opinion leaders, or how will you actually sort of reach out with your
Yeah, that's definitely part of it. Reaching a few key opinion leaders, I think, are the ones that are going to help drive the early adoption. We've been very fortunate to be part of this multi-year collaboration with the 4 pharma companies that I've mentioned. So we've had an in there. Past that, it's a lot of direct outreach, to be honest. We need to find the right people in the right departments who are doing a similar assay and connecting with them. Conferences as well works. So
yeah, of course. I'm thinking of the money that you raise. You also want to raise 4 million in 2 years, I think, from now or something.
3 million after this would be the Series A is the projection. Yeah,
sure. And what are the use for the money? What are you planning to do for?
Well, so there's the scale up. So there's going to be a big increase in the team, specifically in the sales functions there to really scale up the sales. That's also where we're going to need to really solidify our quality control processes. We're going to have people in-house to help with that because if we're going to be pumping out volumes of these plates every month, we need to really make sure that each one lives up to the right standard. And if something goes wrong, we need to know why. So I'd say those are the big functions. Sales mainly, I would say.
Yeah, yeah. And do you foresee any bottlenecks when you scale up?
I would say the production side is, I mean, none of us on the team have experience doing that. So we're definitely going to need some help figuring out the logistics there with how we time different instruments and how we can get the production cycle running smoothly. And again, I go back to the quality control. It's going to be very huge. We don't have that competency in-house right now. So that'll be something that we need to look for.
Yeah. Yeah. Who owns the company now?
Who owns it?
Yeah.
Exactly. 80% owned by the founding team. And then we have Chalmers Ventures on board as well.
Okay. What kind of feedback do you get from your partners?
Well, they've joined this collaboration project with us because they want the product.
Yeah,
that's the feedback.
Okay, so it's nothing new. No,
they're investing their time and money to get products like this.
Okay.
That's what I can say. I know that they want these tools. There's not a need for us to convince them that these tools are better. It's making a tool that will actually work in their hands, in their labs. That's the challenge that we're solving.
Yeah, okay. And the challenge is to everyone to know that this exists, right?
No, I mean, people know spheroids exist. That's pretty well known. It's just they've had a hell of a time trying to get them to work in their lab environment. It's okay if you test maybe one drug and run a few, you maybe do 100 spheroids or something. But if you're in the thousands or tens of thousands of data points or hundreds of thousands, that's when it becomes challenging. Yeah. So that's what we're looking to solve.
Yeah, I understand. What kind of competition do you have in your business?
Yeah, there's a few different types, I would say. There's companies that offer sort of do-it-yourself kits where you can still grow the spheroids yourself and they give you everything to do that. But then you run into the same issues that I highlighted in that workflow. You still have to culture them for 7 days and there's things that go wrong. There's companies that do 3D bioprinting. For example, CellLink is here in Gothenburg as well. They can create, again, much more complex, larger organs, but that's not something you use this early on. It's something that could be used a bit later on when you have less drugs to work with and you want higher complexity. And then you have companies as well that, they grow their own models as well and do a service. So there's a lot of CRO companies that do that as well, but they've also been positioned more closer to the clinic, let's say.
Do you have enough partners, do you think, for your commercialization part, or do you need to find more? I mean, you mentioned sales. So
I think one key partner for us going forward, especially if we think about moving into different markets, is going to see if we can find a distribution and maybe even a production partner. I think about the US, for example. I know I spoke to a company that was shipping biological material from the UK over. It's a bit of a hassle. So we're looking into, if we move over there, do we want to have our own shop set up, or can we actually partner with someone who maybe sells biological material already, cells or something like a bio-IVT type, who could actually do it for us and distribute? I think that would help us accelerate the sales faster than we could do internally.
Yeah. You're a private company. You have no plans of an IPO or so?
I wouldn't rule it out. My thinking around that is when I look at other companies that are similar to us, I've seen primarily that they've been acquired as an exit vehicle, let's say. I'm not against it, but considering that would be somewhere maybe in 2032, it really depends on the climate at that time. And also, frankly, it's probably going to be out of my control to decide that. That'll be an investor decision. So,
yeah, of course. Yeah. Thank you very much, Chris.
Thank you.
We have to move on.